So we'll start the program right now. I welcome all of you for this live session on how to prepare for career in medical field. When one opts for medicine, they're not opting for a career option that is like any other. When you save life of a person and see them making a difference to humanity, you realize magnitude of change that you can make by your efforts as a doctor. The long study period, balancing professional commitment of being available 24 into 7, as well as engage in continuous academic learning of latest advancements in medicine. One needs seemingly unlimited stamina to consistently deliver the best to the patients. This is something that all doctors in the world would agree to. How is it like to be a doctor in the 21st century? What are the crucial factors that one should keep in mind to carve out a career in medicine is something we will discuss today with our guest speaker, Dr. Simon Thomas. I request Ms. Hitakshi Bhutton to introduce Dr. Simon Thomas.
Thank you, Shubhra ma'am. A very good morning to everyone present. On the behalf of St. Xavier School, I would like to welcome our guest of the day, Dr. Simon Thomas. He passed out Xavier's in 1995. He pursued MBBS from Government Medical College, Trivandrum, Kerala. He completed post-graduation in orthopedics from St. Stephen Hospital, Delhi. He then did his advanced fellowship in joint replacement from Germany and currently working as a senior consultant in joint replacement in Sun Permanent Hospital. He specializes in hip, knee, and shoulder replacement. Thank you so much, sir, for taking out some precious movement to enlighten us. Amongst the participants, we also have a girl whom you met as a consultant and today as a guide to the career. Over to you, sir.
Ah, thank you very much. I think I'm humbled by all this fancy introduction. I would, I don't know what to say. I believe, I would love to believe that I'm even half of as great as you've made me out to be. Uh, Good morning, everybody. Good morning, children. And today, when I talk to you, I think I am, taken back to maybe a quarter century back, 25 years back when I passed out of school, St. Xavier School. And Mr. Devasya, Mrs. Sharma, Mrs. Bhutan, they have given great introductions about me. But when I was in school, I was, I think, a very, very, just an ordinary child like all of you. I was, I would go to school, come back home, do my, general homework and things like that. And I never had this, inclination to become a doctor from childhood. My mother was a staff nurse in railway hospital, and my I think sometimes when I was used to go to visit her in the hospital, sometimes I would meet some doctors here and there, and when we fall ill, we would find some doctors who would help me out, and I thought that these people were doing a great job, and they influenced me, and that is one reason why I thought my thought process started influencing towards becoming a doctor. And uh, people also, I used to come from a middle class family. People thought that in our families we thought that if you become a doctor you'll do financially very well, and that was also one thing which came into my mind. My parents told me, doctor banja badhiya acha ho jayega. uh, but then those are other things which I will come on to later on. My schooling, I remember Mr. Devasya, Mr. Das, and a lot of other teachers who molded me into this profession, because they gave me motivation, that I had the potential to be of use to some other people in society. I don't think they did that to me in specifically. I think that was a general message to everybody. Some of us took that message on and built it up from there. And I remember Mr. Devasya, especially Mr. Das, he texted me in the morning and said, "Son, all the best. Do very well. We are actually, glad that you're going to talk to us after a long time." I remember Mr. Das, 25 years back. He was very very stern to me, and today the way we talk to each other was totally different. So as a child, I used to think, yeah, this guy does not like me. I think he always keeps on scolding me. And now, when I reached one level, I realized that he scolded me because he liked me. He thought that I had the potential, and if I did not have the potential, he may not have worked this hard on me. And I'm thankful to all my teachers and mentors in school who have made me reach where I am today. So I told you how my decision to start my career in medicine came out to be. It was subtle, like everybody. We don't get influenced to become a doctor, on day. It's small, small things which in our life, which makes us choose what we want to be. And what kind of coaching did I do to start for my entrance exam? Actually, in my times, it was a little more easier than what I think it is today. But one thing which was told to me by my seniors was that if you had to prepare for your entrance after 12th, you had to start early. And in my times, we started somewhere in standard 10th only. And I joined a coaching center. And that coaching center gave me, I don't want to take names because there are many. And I think they're all the same. You have to, decide and choose what you want to get from where. So I went into that coaching center, and I got there were two advantages of going to a coaching center. The first was that I was ahead of my times. I was learning early things which people would start to teach me in 11th. I started doing in 10th. And what the course would be in 12th, I was taught a little bit of that in 11th. So that was one advantage. I had a head start. Second thing is that mm, I got a peer group, a few more students who were like me, and that peer group encouraged me to work a little more harder. So when I was in sixth, seventh, and eighth, I was a little laid back. I was scared of getting poor marks, so I would submit everything on time. But then that's just about it. By the time I reached to 10th, I got a good coaching center. I got a peer group which pushed me, and that pushing helped me because when you have to give a normal exam, you have to just score a little percentage, and that is easy because you have to study and study hard and do whatever good how nicely you do, and you will get a percentage. But an entrance exam is not about getting a percentage. It is actually an elimination exam. It is about percentile. Although children today, the children today may be getting 95% and more. Some people may be getting 99. But you realize once you see the rank that you may have 15 people ahead of you already, and you've won the top 99 marks. You've got it. So the advantage of a coaching center as well as getting a peer group was that it pushed me harder. So get your peer group also in order, and that peer group is not only about getting more marks. It also supports you. Once you don't understand a topic or subject, they were there to help me out, and I was there to tell them also. So that helped me. And struggles in carving a career path and how you overcame them. My biggest struggle in carving a path in medicine was that I was the first doctor in my family. I had nobody to guide me to what to do and what not to do. But to some extent, it was a blessing in disguise because I never realized that if I did not qualify for MBBS, I would be able to do anything in life. When I was giving my entrance exam, I thought that if I did not, become a doctor, I would not do well at all. But uh, once now I see people who ask me what we want to do, I tell them that it is not just about MBBS. Even if you don't qualify for MBBS, there are multiple other courses which you can think of. There is a dentistry that can be taken up, biotechnology, pharmacy, and my I think my brain gives me away this time, but I'm sure there are many other courses which gives you an insight into a medical field. Medical technology, biotechnology is also one of those fields in which you can be related in some extent to the medicine field, not exactly an MBBS doctor, but you can foray into this career where you are in touch with medicine and people who deal with hospital admin as well. What excites me about medicine in general? I think the best part about medicine is this is the most direct way in which I can be of use to people. Whoever comes to me comes with a problem, and I am of I think it gives me immense happiness and pleasure that I am able to help them out. Whenever somebody comes to me, although they may be paying me a consultation fee, I don't think of that thing, that I'm going to get a fee out of them. What I think is that they have come to me with a problem, and I will be able to help them out. And that gives me immense pleasure. And one thing which I want to tell you, all children, at this time is that even though uh, some of you may not become a doctor, some of them you may not go into a medical field, always remember that whatever you do in life, whenever somebody comes to you in need, you can help them. You don't have to be a doctor for that. Sometimes somebody may be an electronics engineer. Some of you may be going to some of you may go into an automobile. Some of may go into administration. Some of you may go into politics. So once somebody comes to you and he asks for help or she asks for help, you have to think, how can I help this guy? And for helping somebody else, you don't need to be in a particular profession as such. I think some of the children also may think that becoming a doctor will make you famous. Yes, and it will make you look like a celebrity. But I'll tell you one more thing. We all know, we all doctors and all people into medical science don't become high flying people. We are not on the internet or the TV all the time. But even as doctors, we have the ability or the gift to make a small change in the micro environment where we are. Maybe that microenvironment may be the school where you study. May be the house where you are, where you are staying. Your neighbors and your friends, they may be getting a little bit of help from you, and that is the biggest, plus point of being a doctor. And I think even non-doctors have that ability if you take it out. My typical workday is extremely heavy, and I start my day at around 7 o'clock. I have a 15-minute wonderful drive where I listen to music, and I reach hospital. By the time I reach hospital, my first case is scrubbed up, and I have to operate a few joint replacements cases like hip and knee replacements, which is my major work day. And I finish all my surgeries by around 12:30. Then have a quick bite of lunch, maybe some cup of coffee in between, and then I start forward to my patient department. I see some few patients, and then I also, get to take a round and see what my admitted patients are looking like. And by the time all of this ends, usually it is about 8 or 9 o'clock in the evening. So the typical day is very, very busy. And as you become a little more, aged, and your experience increases, your days are going to be very, very, busy. And so whoever wants to become a doctor, successful in the sense ki you want to reach out for more people, you have to be very, very ready to be busy. And there are a lot of branches in which you're not that busy. And there are some branches like orthopedics and surgical branches where, once you operate, you may have problems, you may have troubleshooting sessions, and patients are always, in need of you. And these are those branches in which, the work hours are very, very, very high, and you have to work till late. There are certain branches like dermatology, that is skin, the radiologies, that is X-rays, and there are other many, the ENT, the ophthalmology people who have a little more lighter schedule. I think that all depends on how vast your subject is, and how big, that depends how much busy you are going to be. And the other question that was asked to me was, how much time does it take to become a doctor? So the basic course is an MBBS, Bachelor of Medicine and Bachelor of Surgery. It is a 5.5 years course in total, including a 1 year of hospital attached internship, in which you go to different, specialities and work for 15 days, 1 month, and get an overall view. And at the end of that 1 year of internship, you will get a certificate to practice as a medical doctor in India. That is an MBBS. An MBBS is basically enough if you want to do a general practice. And a lot of people who do MBBS may set on to a general practice where you do, general practice. You will take care of your, people around in your small societies and your cities and all. Then you can become a specialist. For becoming a specialist, there's another exam, which is again the NEET exam, and that NEET exam is the same exam as what you write after your 12th to become an MBBS doctor. But after clearing this NEET exam, again based on the ranks and your interest, you can actually choose on to what specialities you want to go. And usually after an MBBS, what the specialization is called a MS or an MD or a DNB. MD people are basically non-surgical branches, and MS people are people master of surgery and master of medicine. So the people who take an MS degree or a DNB degree, they are the people who actually are going to have surgical fields as their specialities of interest. And after you do your there's some disturbance there. Uh, After you do your MS or MD, then you become a specialist. But a lot of people actually will settle here only, and they will start to do the specialty practices. But there in 21st century, uh, hello, hello, yeah, in 21st century, the subspecialty practice or a super specialty practice is also going on. So you have spent almost close to 6 years to, do your MBBS, then 3 years of your post graduation or a specialization. So 9 years are already gone, assuming that you have got through everything in first shot. Then comes to your fellowships or super specialty practice. See, I did my general orthopedics DNB and I started practicing. But I thought that I want to do something else. I want to do joint replacements in particular. So I took up what is called a fellowship in joint replacement. So there are some long-term fellowships which can last from 6 months, 1 year, sometimes 2 years also. And these can be done from various specialized institutes in India as well as outside. And once you do them, you become little more trained to do subspecialty practice. So then my main work is not just about orthopedics. I am mostly doing now hip and knee work alone. But my colleagues who have done an MS in orthopedics, they would be practicing everything. So I am a little more specialized, and that's how the case with people who general medicine. Then they take up nephrology, that is disease of the kidney. Then some people after they do the general medicine, they take up cardiology. That means people who deal with heart. And in heart also there can be all specialties. So, but the more deeper you go, the more years you have to spend into your studying. But the best part is that after your basic post graduation, rest of all studies or the fellowships are not the classroom teaching studies courses. They are basically work by side. So you're actually working like a consultant and you're gaining more knowledge. So it's not a classroom kind of teaching anymore after your post graduation. So at least for a specialist to come out, you take around 9 to 10 years of actual study. Uh, you become a super specialist. Is it a good idea to pursue MBBS from abroad and start practice in India? Actually, practicing in India is a different ball game from a practicing outside. So a lot of people ask me this question. It's a wonderful question. What I think is that people who are going out of India, they should think of two things. First of all, they should try to go to places which have English medium as a language if possible. The advantage of that is that you get more oriented towards what you're studying, because a lot of people have communication issues, and that is a hindrance to gaining knowledge. Second thing is that if you go to a place where English is a language, usually what happens is that you sometimes get absorbed into their system, and then you can do a post graduation and other things from there, and maybe sometimes people also opt to settle abroad also. So that is one other way to go. Should you drop an year to prepare for MBBS? It's not a bad idea, because in this big world, big life of ours, sometimes when you're in your 12th standard, and once you've not made it up till there, you realize that should we drop it or should we take something else? Then that is a question you have to ask yourself. Nobody can answer this for you. What was the rank in this entrance? Do you think you had it? Do you think you did your best and still you could not make it? Do you think you're just close? And if you think that these are the answers to these questions are yes, there is no harm in leaving 1 year aside, because at least if you like this subject and you drop 1 year in this big life of ours of spanning 70, 80 years, even if you drop a year, nobody's going to realize at the end of 10 years. So don't worry if you are dropping 1 year, but you have to ask, what different am I going to do this year? If you think you can make a difference in your next year's result, then I would suggest to you, please put back everything else.
Don't think of an alternative. Do what has always called you.
And how can students maintain their calm when the pressure to perform and meets one's aspirations is very high? Uh, I think that is a very difficult question to ask. See, I'll tell you one thing, which I think Father John Ari told me when he was a principal and I was I was in school. I realized that, have you children must also have seen this. Once you're coming for maybe your midterm exam, if you're coming for your first term, your second term exam, and you're standing in the assembly line, there are certain children who are actually keep on reading. There are certain children who just ठीक है सब हो जाएगा ठीक है okay हो जाएगा ठीक है. And I was those guys. I did not realize what to do, and at the just before the exam, and I would always feel ki, hey Bhagwan, will I remember everything that I read? Will I, whatever I have done, am I worth it? Have I done enough? And I think people who are preparing hard will always be a little insecure. That does not mean that you will not perform well in exam. So you have to remember and you have to ask yourself, have I done enough in the last 1 year? Have I done enough in the last 6 months? Have I read everything once? Trust me, if your mind, your heart tells you, नहीं मैंने किया है, मैंने सब पढ़ रखा है, अब जो होगी वो थोड़ा भगवान पे छोड़ देते हैं. I'm sure you will do well in the exam. Those jitters before the exam, oh will I be able to do, हो जाएगा नहीं हो जाएगा, oh एक क्वेश्चन गलत हो गया तो मेरी रैंक चेंज हो. These are all things which come to everybody. These are very natural. When people people who have not prepared, they'll go cool, कोई बात नहीं, चलो ठीक है चलता है, होगा नहीं होगा ठीक है. And there will be people who are extremely nice, extremely brilliant, who they'll know मेरा तो होना ही है. But I was one of those middle people who was working hard, but who was always a little, oh भगवान मेरा होगा नहीं होगा. So I think 75% of people who are going to write the entrance exam are like me, who have done the hard work, who think they have it in them, but who are not very sure. But unfortunately, that surety will only come after your exam, and that you have to leave it. You just have to ask yourself, have I done enough? If that answer is yes, go ahead, remain calm, drink a glass of water, have a good time, write your exam well, and you do very well. And what is the best strategy to qualify the entrance exam for pursuing a career in medicine? I told you before only, start early. Start early. Do extra. The entrance exam that you're going to write is not an entrance exam. It is an elimination exam. And your competition is not just to what your peer group in the school is to your competition is with the peer group of other schools and the cream of the top rankers of the other schools also. So the only thing I can tell you is that start early and be consistent. Last moment studies won't help you. It is only somebody who's consistent and who starts early. That is my two message for you guys who want to do this. And I think, can you guide us about some avenues of science students in paramedical areas other than MBBS? Oh yes. If you don't get into MBBS, this is not the end of life. First of all, a lot of my friends and colleagues who did not get into MBBS are doing wonderfully well than me. And how are they doing better than me? I will tell you. Sometimes when I was in your age, I thought it was all about money. Happiness came from, I thought, oh, I'll get a good car, I'll get a good house, I'll be happy. Okay, I have a car, I have a good house, but I think if I have to be happy, I realized that it has to be from that what I do, if I like what I do. And some of my friends who wanted to be doctors, they became, one of them became a paid tech. One of them is doing very well in engineering. He always wanted to be a doctor. Now he heads the marketing of a big international company in India. And he himself cannot believe that he had wanted to be in this position. And so sometimes nature and life will carve out a path for you. So if you've not taken up, if you wanted to do an MBBS, still you not could not get it. It does not make a difference at all. And I told you so many branches which are related to medicine in which you can go, in which you may find that you are happy and you're dealing with some, you have some touch with medicine as such. I think I have answered almost all my questions. And anything else you want to ask me or I have missed out, I'll be happy to take it on now. Am I audible?
Yes, sir. Yes, sir. You're audible.
Yeah.
Yes.
It's very awkward talking to yourself on the phone. It very unlike.
Once we start hearing from the students, I think we might just experience a different set of emotion.
Sir, I had a question.
Beta, if you can share your name and
Uh,
then begin.
I'm Parika Goswami. I'm recently studying in 11th standard. I had two questions in general. First, you've done a fellowship from Germany. I wanted to ask that how going abroad formed you into a new person or how it changed you. Secondly, I wanted to ask what do you prefer if I want to pursue my career in research in human anatomy?
I didn't get your second question actually. What was the second question?
I asked, what do you prefer if I want to pursue my career in research? As in, how do you think that, what should I start doing from now that would help me later on?
See, I think that's a good question. I think I recognize your father. Okay. Hi, Mr. Goswami. Okay.
Yeah.
Yeah. So the see, I think 10 years back, um, the kind of work that was being done in the West was a little more different. I think they were a little more advanced than what we were doing. I think one of the questions asked to me in 21st century, in this thing was, how is 21st century practicing medicine in India? I think I'm very proud to say that whatever whatever latest research that comes in the West is now available in India also. Technology wise, skill wise, we are no way behind. 15 years back, 20 years back, somebody had a cancer, they would rush to US. Somebody had a cardiac problem, they would maybe go to Mumbai. But not, the times have changed. I think my fellowship in Germany was in those times when actually they were a little more, advanced than us in terms of technology and the patient profiles, but not anymore. I think people who are now doing, their post graduation and post fellowships are very satisfied with the kind of work that we do in India. We have the infrastructure, we have the patient mentality, which is having more trust on us doctors. And I think the kind of work which is now being done in India is path breaking. And can you believe that 90% of cancers are now curable? And there are a lot of people who talk about cancer survivorship and people who have defeated cancer. Can you believe that 90% of people who have cancer, they are fully cured now? Something which was unheard when I was a child. So going to for an overshare fellowship you can do, but it is not going to be a path breaking thing. What it can't be done in India. That's one question. Second thing is research. Yeah, this is one area in which India is still lacking. We are so busy in, people who do good practice are so busy in practice that research is definitely suffering in India. That's what I feel. So if you're planning to take up research, then you might as well think of, if you're thinking of doing a BSc and you're doing a master's, then you're doing a PhD, then you might as well think of you opting for a foreign university as well. Because in these areas, if you get a good if you get a good research subject, then you might actually would be paid very nicely, and you will be able to, the why I bring about by of I bring about the subject of getting paid is that, see, Once you're 12 years into research, or you're 12 years or 10 years, and see, now you're very young. Once you have family, you have your children, and you have a husband, and then you think of research, you want some money also to come to your life. You cannot just keep on doing research on your parents' money. So if you go to an outside university, then the perks and the pays are a little more better for a research worker. And then you can actually concentrate everything on actually doing research rather than thinking about what is going to happen to my house next month. In that way, I think research, jobs are much better if they do outside India. Although Indian government, ICMR, and the government is now more proactive, I think things may change, and I would be happy to be proven wrong by somebody who has more experience in this than me. So I think this question you asked to maybe not the very correct kind of person. You should actually talk to people who are actually into research. But I have given you my view of it. I hope I've satisfied you in some way.
Yes, sir. Thank you so much.
Dr. Simon, we have a chat option also available, and there are few students who are asking a question. So we have a question from Vivek, who's asking, how do we choose the specialty that would be best for us after MBBS? So, how did you choose to become an orthopedician?
Oh, I'll give you a very honest answer. I'll give you a very honest answer. This is very difficult. Okay. What we can realize, see, I remember the first day of the few 17 years. Imagine yourself as 17-year-old children, teenagers who go into medical school. First day, we go into the dissection hall. We have 15 dead bodies there. Three people right in front of me were fainted. I almost puked. All those who fainted, who thought that we would never be able to do this, are the biggest of surgeons I know. They're now cutting open people, rectifying things. So you just cannot know what you're going to do. You have to just let go with the flow. Yeah, what after, see, these are certain things which I cannot tell you because you've not gone inside. But during your MBBS time, a lot of people decide on two things: whether I want to do a surgical branch or whether I want to do a non-surgical branch. To be very honest, I always was a docile kind of person, and I thought that I will go into non-surgical branch. And orthopedics was never on my wish list at all. I hated them. I thought it was too gory. And in fact, the kind of orthopedics that was practiced 15 years, 20 years back was totally different. Also, people hanging around in plasters and things like that. Those wards are gone now. And I gave my postgraduate exam. I always wanted to be an anesthetist. Why I was always wanted to be an anesthetist was my first house job. The first job that I got after I finished my degree was in the anesthesia department. So a lot of people who will take up some field will also depend on the first posting they have after the first job that they get. Some people get into casualty, some go into cardiology, and then they get influenced because as once hello, there's some noise there. Yeah, once in your MBBS time, you're so young that nobody takes you seriously. You're taken seriously once you have a degree in hand, and when you do the job in a department, it influences you. So I was influenced because I saw some wonderful work by people, and people who went into and took up nephrology or something else, or neurosurgery. They were people who had seen some kind of work. So in your MBBS, you will just decide whether you want to do surgical, non-surgical, and then sometimes it's peers, sometimes your rank, and sometimes the first or second job, or maybe somebody in the family. So that's a very gradual question which comes. It will not be answered in a day. And it also depends on what ranking, on the base of ranking. Sometimes you get to choose between two specialties, this or this you have to take. And then you start talking to people, and then you get like that. I wish I could give you a watertight answer, but this is how it goes. I've got a few more questions. We chose the specialty that would best for us after completing, that is become an orthopedician, go in research. Um, how were you able to become an orthopedician? How were you attracted towards it? I think I did not realize that I liked orthopedics till at the time I joined orthopedics, and the rest is history. Now AIMS is also included NEET, so will the standard of NEET increase? I think the standard of NEET is way high anyway. I don't know whether they can increase it anymore. So people who are aiming for, see, AIMS is a big hawa. The standard was always the same. The only thing was the number of seats were limited, and sometimes because the number of seats are limited and the people who are writing for the entrance exam is much more. So we always thought that AIMS was altogether different ballgame. It's not like that. I think the standard of somebody who's passing through AIMS or passing AIMS entrance exam or a normal any other medical college is the same. So I think people who are giving it a shot at MBBS anywhere should actually get a shot at AIMS also. Will the syllabus for NEET be edited because AIMS and GPMS are much indeed? See, I think I am not a policy maker in this, but I think this is not what you should be asking me. I'm Kritika of class 11. Is it important to join a coaching center to crack NEET? Yes, it is. I told you why it is. It is important because it helps you meet other people, and it gives you a peer group, whom you can chat around, and you start early. Good morning, sir. The study has been disturbed due to coronavirus. Is possible to cut in syllabus in turn? Should we do it for 20-30%? I don't think, Bache, Pratham, you should be asking me this. Violation against a doctor is becoming common in India. What's your opinion in this context? I think that's a very, very valid question, and this is the perfect platform on which I should be taking this up. Actually, the problem is not the doctors or the patient. The problem is something else. The problem is communication. The problem is communication. Doctors know everything. The patients don't know anything. Because we know everything about the disease. Patients come with a problem, and patients come in panic. They have an emotional overlay to their problems. Doctors see the problem and they analyze in a non-emotional way. And sometimes the result is not good, not just because the doctor has not tried hard, or the doctor has been negligent, if I can use that word, but the problem is that the patient had a bad chance of surviving. But the problem comes when the doctor is not able to communicate that with the patient. And whenever something bad happens to a patient, the relatives think that we were not given a fair deal. And in that context, the patient is also right, that he was not talked enough. So I think the biggest problem now is that the communication, which is not taught to us during our MBBS time and post-graduation time. We are all busy getting more and more technical. We are all busy getting information, studying hard, and becoming great doctors. But what we need to understand and learn is also good communication. And one word, empathy. This empathy is the word which was given to me by St. Xavier School. And I'm proud that I'm passing on this to you. Whenever somebody comes to you, whenever you become a doctor and somebody comes and sits in front of you and he tells you a problem, don't think that he is in problem. Think, what would I be doing if I was in his place? What kind of a treatment would I be wanting for myself if I was in this guy's place? It may be in terms of money, in terms of whatever surgical treatment or medicines that you're going to give. If you think as a doctor that if I were the patient and I got this kind of treatment, I would be happy, then that is the same treatment you should be giving to the person in front of you. If you do that, I think a lot of problems will be solved. But then there's a big world. There'll always be misunderstandings. There'll always be some problem between doctors and patients. But what you need to understand is that if your communication is good, then a lot of these things can be sorted out. Kindly tell us to some simple tricks that you have to learn and revise. The simple trick is to start early, do again and again, do again and again. That is the trick. There is no other trick. Get some mnemonics in order. Do group discussions. I think we don't understand one thing, that sometimes we're all competing to each other. There's no competition to your best friend. You and he will be always together. You may become a doctor or you may not. He may become a doctor, he may not. But then always remember that if you study together, then दो और दो 22 होते हैं, एक और एक 11 होता है. Sometimes, I still remember. I'll give you a small anecdote from my MBBS time. My best friend Sijo Joseph, he, in the exam. Sorry, I should not be saying this on school platform, but I hope the teachers are not listening. In my forensic exam, the guy, he was sitting right behind me, and he asked me a few questions, and I knew everything, and I told him, and I gave him the answers. And he was thankful that because of me, he passed the exam. But when the result came, he scored more than me. And I was flabbergasted. He started laughing. And can you imagine what happened? That evening, he came to my hostel room. He said, "We'll go to the university." He paid money for my re-evaluation of forensic exam. And tell you what, my marks were increased by 17 marks. He told me that if you told me this much and you cannot score less than me, I got a distinction in forensic science. And that is what friendship is all about. So do group study, do interact with people, and they will give you more. Being an intern, did scut work help you? I don't know what scut work is. I'm adjust from 10 salary and various disciplines of specialization. Would it be possible to summarize how many disciplines are there in total? How there are n number, there may be 50 or more. And is there option graduation level, MBBS level? No, no. The MBBS or the graduation level, you do everything. Everything you do, and after that you specialize and you take into one field. I'm Hitesh Gupta from 12A in Agruvi PCMB. In these 2 years, I decided to pursue non-medical instead of medical. For master's, I used to join college in foreign. My question: how will a life in foreign abroad affect me in your life, in your belief, in your way of living? Yes, absolutely. That's a good question. If you go abroad and live, your standard of living will definitely go higher, because the air is cleaner, the competition is a little bit less, and I think the hustle bustle of life is very less. But जब हम लोग बोलते हैं ना कि मेरा भारत महान and everybody can see, so we don't realize this, how lucky we are to be living in this society. Once you go there, you'll realize that you got the best in life. In my 6 months of fellowship in Germany, I was lonely to hell. I was alone. I would go back to the hospital, come back, and I would open the door to a neighbor who did not know me, who would not smile at me. Germans were always a little aloof, and those times that I spent there was horrible. And I could not shout, I could not smile, I could not frown, because I thought this is a foreign country. I was always looking in my pocket to see where my passport is. And coming back to India, it is wonderful, because it is my place and I can do whatever I want. And I know a few people out there. I know even the police wala there, and so life is a little more. I've got parents here, I've got relatives here, I've got friends here. Chacha, mami, nana, nani, sab log hain yahan pe. So life in India is wonderful. It is not. I'm not saying that it's not bad there, but you will miss India once you go out. So once you go to a foreign country, you should be, you should be knowing that there will be some loneliness there. What helped you be consistent in your studies? That's a great question. What helped me be consistent in my studies? The fear of failure. I was always scared that I would not do well. I would not clear the entrance. That was the only thing. And over a period of time, what happened? Initially, it was a scare. I thought that, I have to do good. I have to do good. Then what happens? And I started to do good, because I was scared first initially. When I started to do good, people started appreciating. My friends started to appreciate, he's good in studies. My teachers, ye to acha ladka hai. That became the motivation then. So the initial part was a little difficult, but jaise ye sab hua, to everybody started, ye to acha hai, Simon is good, Simon is good. So, and that gave me additional motivation, and then it became a part of life. If a person does not clear NEET, what exam he wants to participate in biology? I think I answered that. Vidhi Bhargav, I'm a student of class 11 and I'm on a role and guiding as a role model. So my question is, what would be 2 things that you would suggest, recommend us to follow in order to gain success in medical institution with good rank? I told you, be consistent, start early. How to enter medical? This I told you, better do MBS in private college. What are the good private colleges in India? Well, I think you can Google that. You can Google the ranking and the pass percentage of various medical colleges in India and abroad. How to balance between maths and bio. I hated maths, so I thought they'd throw it out of the window. But then I know I'm biased. You guys have to, I think sometimes you just have to go on. तो मैथ्स को निपटा दो 12वीं तक, क्या दिक्कत है? ठीक है, एक बार हो जाएगा, अच्छा हो जाएगा, मार्क्स आ जाएंगे, फिर भूल जाना उसको. क्या है, 6 महीने रह गए हैं, कर लो उसको मैथ्स को. I've taken physics, chemistry, biology, and psychology, but someone told me that I will not be able to get physics unless I will not study maths. So I want to ask this to, but this is what you should ask. I think your teachers. Can you please tell me some important books that you think is important from me? Oh, that is a great question. From the time in 1995 when I cleared my entrance to this, I feel ancient. My son is in class 9. Sometimes he studies, and he yesterday asked me what is a Golgi body. Samir is, I think, somewhere in the list. He's also listening to me. He started to ask me what is Golgi body, and I was thinking, oh Bhagwan, what is Golgi body? I have not I have not, thought about that because I don't need this in my daily practice. And my wife and my son could not believe that I was taking time and telling what is a Golgi body. So don't ask me what books you need to read. I'm sure you go to the net, you'll get all that. Uh, Sir, how to maintain the focus on NEET exam amidst the pressures from parents, friends, and relatives? Gretel, that is a wonderful question. That is a wonderful question. I'll tell you why. Gretel, once this seminar is over, you should go sit in your room and you ask yourself, why am I giving the NEET exam? Why am I giving it? Do I like the subject? Do I want to become a doctor? Or am I here to fulfill my parents' dreams? See, if the answer is that if it is to fulfill your parents' dream, then you think about it again. There are two ways also, because sometimes when you are very young, your parents' dreams are actually very mature and they actually may be good for you. But if it is only if you're qualifying, you're trying to qualify for the exam only for your parents and not for yourself, then maybe at the end of the day you may not be very happy. So this is what you need to discuss with your parents. So do this, and if your parents dream of you becoming a doctor, it's a great dream. I think that's not a bad dream, but still sometimes you don't feel the same. And if you don't feel the same, don't go for it. Because if you try to do something for your parents, then once you have your children, you will pass it on to them. Now this is my turn. You have to, do what I did for my parents. That's not how it works.
I'm sorry to intervene in between. We have around good 8 minutes left. So I think we'll be taking the last set of few questions.
I think I'll cut down also. I think I've answered almost all of them. I think the rest of the questions are all repeated, India or abroad. See, if some people, I'll just answer the last one. The thing is that people who you want to settle outside, they may be having some roots outside India. They may have seen some people outside. So if you wanted to have a career outside India, it is not a bad option to start at a young age. And it is definitely beneficial because in the structure outside is much better, because here even after doing an MBBS, the number of seats that you have for post graduation is very limited compared to an MBBS. Suppose you have got 100 seats for an MBBS, once it comes to post graduation, it will be 10, maybe 15, and that also after reservation and all, it will come down to very, very less. So the ratio between a plain MBBS and a specialist is lopsided, and for a super specialist even less. So people who go to abroad to study, they may be having a better chances of going into their specialization. Do I have to study abroad, need pass any exam? Yes. Once you have given your MBBS, you've taken your MBBS from elsewhere, they have to give a licensing exam by the MCI, that is a Medical Council of India, so that they know the university from where you have passed is at par, and your standard of teaching has been at par with what the Indian government wants for us to practice in India. And that is a wonderful decision, because if you study your MBBS in India and you want to go to work in the US or the UK, they also have a similar licensing exam. So after getting an MBBS from India, if you want to go outside, you have to pass a licensing exam from there also. So that is the same with the Indian government. I think I want to research modern mechanics, so the research is always better outside. And family expects so much from us instead of motivation. No, Kritika, just I want to take this for you. I also thought this. Family does not expect anything from you. They expect the good of you. It is your thinking lag raha hai ki my father or mother have great expectations on me. They'll be happy. They'll be happy. Even if you don't score in NEET, even if you score a little, you will always be their daughter. Say this, I have never met your parents, but I can say this because I have a son. He also thinks कि मैं यार वो हमें मुझे डांटते अच्छा करता हूँ तो कुछ बोलते नहीं है, खराब होता तो डांटते रहते हैं, हाँ तुमने ये नहीं किया, तुमने वो नहीं. You come and tell you every day you are wonderful, but trust me, once you sleep, they see you, ठीक है, they must be feeling that you are a wonderful daughter. I am telling you because I have a son, and when I see him sleep every night, I feel he's a wonderful guy. I would not go and tell him. I would only go and tell him, ah, तुमने ये नहीं किया, तुमने वो नहीं किया. But he's my son, and he will always be my son. And that's the same with you. You will be always their daughter. I think I have answered everything, ma'am, and I hope I'm on time.
Yes, yes, Dr. Simon, you've answered most of the questions that students asked. So I think we can wind up the session for today. I, on behalf of St. Xavier's School, extend a very hearty vote of thanks to Dr. Simon Thomas, who took time out of his busy schedule to be with us. Today, we had the opportunity to hear your thoughts, and this will surely encourage our children. Indeed, the session has helped us come to the realization that doctors bring about a significant difference in the lives of hundreds and thousands of people around the world, and it becomes a source of happiness and self satisfaction. I would also like to thank our Father Principal, our Vice Principal, Mr. Devas, encouraging such initiatives in school. Last, I would like to thank our students and teachers who were today in this live session. May God bless us all. Keep safe and have a nice day.
Okay. Thank you, Dr. Simon, for this beautiful session that you organized. Thank you very much.
Thank you.